I wanted to start with a bit of an overview of what dementia is, because sometimes there are questions that come up, and it's important to have an understanding of that. And then talk about this issue of why women experience more dementia than men. And we don't have all the answers. We have some suggestions and some ideas that we're going to be moving forward with. And then I'll make a link to my one of my main areas of interest in terms of research is on frailty and how that relates to dementia and women in specific. And then importantly, one of the great things that the Women's Brain Health Initiative does is to empower people, or to suggest that there's ways that we can change things, and we'll talk about some of those at the end. So one of the biggest questions that I get when I'm speaking with public groups is what the difference is between dementia and Alzheimer's disease. So we'll start with defining dementia. Dementia is an umbrella term for a syndrome in which somebody has memory and other cognitive or thinking difficulties that interfere with their daily activities. And that functional impairment is a key thing. So with aging, we can all experience some changes in memory, and you'll be relieved to know, for example, that things like forgetting people's names when you're put on the spot, or even going into a room and forgetting momentarily why you're there, that's my favorite one, those are part of normal aging. And it's really when you get into impairment of function and needing help with things in your daily life that the dementia would be diagnosed. Alzheimer's disease is the most common cause of dementia, but there are others as well. So another common one is vascular cognitive impairment, which is changes in the blood flow of the brain, or mini strokes that build up over time. And importantly, we can often see some overlap or combined causes, and that's a really key link to why general cardiovascular health is important for your brain as well. So really, dementia is the umbrella term, and there are different types of illnesses that would fall under that umbrella. Dementia is a progressive illness, and it starts in a mild stage and progresses to more severe stages. So all people, though, with dementia will have this functional impairment. So in the mild stage, people will have difficulty with the more complex activities of their daily life, which would be called instrumental activities of daily living. So things like driving, finances, more complex activities. Even things like doing cooking and housekeeping are in that category. When people have severe dementia, they actually are quite dependent for pretty much all of their basic needs. So things like getting dressed and bathed and even feeding themselves can be things that they'll need help with at the late stages. And in the middle, people will be able to do their more basic things like dressing and bathing, but they need help or cues to perform those tasks. So it's important to understand that dementia is a progressive illness that has these stages. So the key points then are that dementia is the umbrella or the syndrome, and Alzheimer's disease is the most common cause. We have a progression in dependence. And really, when we see patients and families dealing with memory issues and dementia in our clinics, it's a clinical diagnosis, which means that we don't have a fancy blood test or a fancy MRI or imaging test that will diagnose dementia with certainty. What we do is put together an entire picture based on the history of what the people have been noticing at home, as well as performance on memory tests and physical examination and some other tests as well. But it really is a clinical diagnosis, and time is probably the most important ingredient in that. There are medical treatments that are available, and they do help some people. So that's why it's important to get on top of things early. And though really the key thing that we do for everybody who has memory impairment and dementia is around community supports, and that's why organizations like the Alzheimer's Society are so important. So we know, of course, that the population is aging, and the baby boomers have started to hit 65 within the past couple of years. And Nova Scotia is fortunate to have more seniors than average in Canada. And along with this, though, we do know that the prevalence or the number of people who have dementia is on the rise. So this is a graph from the Alzheimer's Society of Canada's work. And it just shows that currently in Canada, there are about 500,000 people who have dementia. And over the next 20 years, this will double to 1 million people in Canada. And the other thing that this graph highlights is that more women than men do have dementia. So that's really the whole point of what we're talking about today. So this question is actually very complex to try to answer. And I've done a bunch of reading around this and have some experience with some areas of this research. And so I've divided into four overarching categories, but I'm sure there are more pieces to this puzzle that we'll be discovering over time. So the first one is demographics. So we do know that women tend to have longer life spans than men. So one could say perhaps the reason that there's more dementia in women is that there are more older women than men. And that could be certainly part of the picture. Even though studies, when they adjust for age, some studies show that there isn't much difference between the genders, but most studies will still suggest that there is more dementia among women than men. So biology is another type of mechanism. So estrogen has important neuroprotective effects on the brain. So estrogen is good for brain cells. And it's a little known fact that actually men have higher estrogen levels than women who are post-menopause. So senior men will have higher estrogen levels than women. And so that was interesting to me. I imagine it's probably interesting to you too. And another key thing in terms of biological mechanisms is that women have a higher burden of chronic illnesses than men. And the word that I've used for that is frailty. By frailty, we mean the number of illnesses and functional problems and symptoms, sort of like an overall measure of health. And the more problems one has, the more frail one will be. So we know that women are more frail than men. And also that frailty in itself, as I'll get to in a few minutes, is a risk factor for dementia. So that's part of why biology might be playing a role. There are also some differences in neuropsychological tests scores. So that just is how people perform on memory type tests. And it's interesting that women tend to perform better on certain types of memory tests, especially verbal ones, like in daily speech. And so there might be something to how mom seems to know where everything in the house is when you ask her. It's my experience in my house anyway. So there is an interesting theory that perhaps women having farther to fall means that women who started out at a very high level of this type of memory function, it's more obvious to their families when they do develop a problem. Similarly, there are differences in social roles and opportunities. So women post-retirement will participate in different types of functional roles that men may not do anymore. So it'll be more obvious if there's a functional decline, say, in cooking and housekeeping, whereas a retired gentleman it may not be so obvious to the family if he's not doing so many of these tasks inside the house. There are also differences in educational attainment, particularly in our older age cohorts, and we know that education is protective against dementia. Likewise, physical activity is protective against cognitive impairment, and there may have been differences in people's life experiences with that as well. So those are just some of the reasons and mechanisms that it seems, or why women may experience more dementia than men. And I'll add too that women tend to be the caregivers for people who have dementia. So even if they themselves are not the most affected member of their family, they'll be bearing a lot of the burden of the dementia itself. So in the bigger picture, the brain is very important, but it's really only one part of the body. It's all connected. So I've used the word frailty, and you can think of frailty in different ways. Really, it comes down to a vulnerability. So being vulnerable to bad things happening in terms of health outcomes or development of cognitive impairment or dementia. And we see frailty in different ways. One useful way is to see it as a balance between the things that people have going for them, such as good health behaviors and practices and resources and having a caregiver, and the things that they have going against them, such as illnesses and disabilities or isolation. Some older people are in a very robust balance between those two sides. So they can tolerate additional insults or problems or an influenza or something like that without having a decompensation, whereas other people are teetering quite precariously in this balance. And any additional insults will tip their balance such that they're no longer able to stay in their home or function, and then they need additional supports. So when we see seniors in our clinics, what we do is called a comprehensive geriatric assessment. And it's a process that takes a lot of time. It relies on talking to the patients themselves and also family members and gathering quite a lot of information. And the things that we go through are these, just to go through them quickly. So we talk about cognition, importantly. We talk about mood, communication, so eyesight, hearing, and speech. Mobility and balance, so they're walking, need for walking aids, have they had falls. We talk about bowel and bladder function, appetite and weight, and importantly, daily activities function, so in the basic things as well as in the more complex things. We talk about social circumstances and supports, the medical conditions that they have, and their medications. So we review all of this along with testing and physical examination and whatnot. And what we can do is actually add all the difficulties that people have in all these areas up to create an overall measure of their frailty. So we call this a deficit accumulation. It just means like the more problems you have, the more frail you are. So we've heard that women live longer than men. And a lot of people would think that perhaps that's because they have less problems than men. But in fact, it's the opposite. There's this really interesting paradox where women have more health and functional problems, yet live longer with these problems. And there's a lot to be known about that. So that's one of the areas that we're actively engaged in researching. So if we think about what risk factors are out there for dementia, we know a fair bit now about vascular risk factors, and a lot of this work was actually done in Canada with Professor Haczynski, who's very well known on the international scene, and he's part of this CCNA project that we'll be talking about later too. So things like blood pressure, diabetes, cholesterol, history of strokes, those all add up to be risk factors for dementia. Heavy alcohol drinking, as well as severe and repeated head injuries, are also types of things that will increase somebody's chance of developing dementia. But interestingly, frailty itself, so having many functional and health problems that are seemingly unrelated to these things or to the traditional risk factors, is actually perhaps the biggest risk factor of all. And this is something that was shown in a study based here in our geriatric medicine research unit, where we looked at older Canadians and calculated their frailty with the number of medical problems that were unrelated to those traditional risk factors. And all this graph is meant to do is say that people who have more problems had more dementia, and it was even stronger an effect than those traditional risk factors. So it's a change in the way we're thinking, and it's something that we really need to get on top of. And it's particularly relevant for women because, as I've said, women tend to have more of these functional and medical problems as they age than men. So that's really one of the key things that we're working on in terms of the research. So Lynn mentioned the Canadian Consortium on Neurodegeneration and Aging, and that is a huge project that's aiming to unite over 300 researchers on dementia in Canada. And we have some important contributions based here in Halifax. So Professor Rockwood is one of the main leaders of this project, and I have a team that's sort of one of 20 different teams studying things. And my team, which has 20 members from across the country, is looking at this specific issue around frailty and having multiple medical problems in relation to dementia risk. And we're working closely with this Women in Dementia Core to make sure we focus on the right questions for women too. So what do we do about it? So there are things that we can do about it from an individual level as well as from a more societal or policy level. So on the individual level, physical exercise is probably the most important thing. Also social activity and integration with your community, and keeping mentally active as well. So in terms of physical exercise, we don't have a lot of time to go through, but essentially what we recommend is 30 minutes a day, at least 3 times a week to get going, and then building from there. And there's actually exercises that everybody can do. And even for seniors who aren't able to stand up, we have a set of recommended exercises that can be done seated in a chair. So we suggest that it be something enjoyable, and that ideally if you do it with somebody else, then you're more likely to enjoy it and keep it up. Also importantly, we don't want it to cause pain. So you don't want to injure yourself or put yourself at risk of falling down. However, exercise is beneficial to seniors to prevent falls as well. So it's something that's just important to engage in. There are different types of exercises, including aerobic, balance, strength, and flexibility, and they can all have benefits. The aerobic exercise seems to be particularly important. And this is a fascinating study that was done a couple years ago, where they randomized groups of seniors into an exercise arm, which is the sort of more aerobic type exercise, versus a stretching group. And then they measured they did brain scans and looked at the growth or the size of different parts of the brain. And they actually found that the hippocampus, which is the top one there, which is an important structure in the brain for memory, grew in the exercising individuals over time, as opposed to shrinking, which would be the normal expectation over a year or so with usual aging. So exercise can make your brain grow. New neurons are bigger, stronger, healthier neurons, and they actually perform better on memory tests in that study as well. So another important thing we can do is social activity. So again, we recommend that people choose things that are enjoyable to them. We don't want it to be like a boot camp for them where they're not enjoying themselves or they're very stressed. But building on pre-existing likes and dislikes is important. Group activities could be anything from socializing with friends and family informally to having more formal engagement in clubs or groups, going to bingo, going to religious institutions. Any kind of thing that people want to do is good for engagement. And there are nice studies looking at how singing in a choir is beneficial too. So in terms of mental activity, there are companies out there that are developing like brain training exercise programs, and those aren't particularly recommended in that studies haven't really shown a specific benefit of any one of these expensive type programs. But what we do suggest is to choose something enjoyable, stay engaged in your community. Reading up, keeping up with the news is a great way to exercise your brain. Doing puzzles, if you're interested in that type of thing, is great too. But we wouldn't recommend any specific brain training software or anything at this point. So getting to a bit of a summary. So really, we've heard also about how women have tended to be underrepresented in studies about brain aging too, despite being more affected by dementia than men. And also importantly, in research studies, we've tended to exclude the frail people from the studies. So you have to be pretty healthy to get into a clinical trial, for example, of a medication, because they don't want your kidney troubles to be causing issues in their analysis, or your liver troubles or your heart troubles. So not only do we tend to exclude women from these research studies, but even those that aim to include both women and men exclude the frailest people. So what we know in the research community about dementia really doesn't represent the reality of who's out there with dementia. And so what I say is that the face of dementia is really a frail, older person, more often a woman than a man, rather than the sort of younger, healthier people with dementia that we'll see in the studies. So what are we doing about it? We have a lot of research that's going on right here in Halifax. And of course across country as well. So we have basic science research that goes like from the basic molecular and chemical level up to we have a brain bank, which is a really great resource here that isn't available in many places across the country. We have groups and labs that are working on discovering new drugs. We have programs in place to evaluate drugs once they are available and are starting off in clinical trials. We also do quite a lot of epidemiological research, so looking at large numbers of people in the population to see what types of factors are associated with better versus worse outcomes. And we have a key role in the Canadian Consortium on Neurodegeneration and Aging, as I mentioned, as well. Other things that we can do, and we are engaged in doing, is knowledge translation, which means really bringing the knowledge that's out there in the research community into practice. Because it doesn't do you any good if it's just sort of sitting in a medical journal and nobody ever does anything about it. And the other important thing that we really have a key role in and need to do more of is advocacy. So we need to advocate for the people who are affected by dementia themselves, for their families, and on a policy level, we need a more coordinated response to this condition because it's on the rise. It's very important for us. It has impacts on not just the person themselves, but also on their whole family and community. So I loved what I heard about the dementia strategy. That's something that we need on a provincial level and on a national level. So people say, what can I do about it? Well, you can do the individual level things that I mentioned. You can go out and exercise right now. And you can also talk to your politicians and support groups like the Alzheimer's Society and the Women's Brain Health Initiative. That's pretty much it. Now we have a pop quiz. So, so if a person finds that their memory isn't as good as it used to be, and they might have difficulty remembering names, does that mean they have dementia? No. Excellent. Yeah, that's right. That's good news for everybody. And what 3 things are especially important for maintaining brain and general health? Exercise, social activity, mental activity, and her diet too, which has some important roles as well we can talk about. So thank you very much for your attention, and I'd be pleased to entertain questions if we have time.